My name is Hannah Grundy and I'm doing my checkoff for the newborn. I have my note card here to guide me, and this is my newborn. So first we're going to be looking at the skin color. She's going to have vernix on him or her, which is like good for the skin. So you're going to see like a cottage cheese type on the newborn. And you're going to be looking to see if she has any bruises or red marks, rashes. So first we're going to start with the vitals. We're going to be counting the respiratory rate, which should be like 30 to 60. And we're also going to be listening to the lungs. So usually with the lungs, you listen to on the side of the baby because the heart is like really active. So sometimes when you listen, even like on the front of the baby or the back of the baby, it can be hard to hear the lungs because the heart is beating so strong. So we're going to listen on the sides. And then you're going to listen to the heart rate. So you're going to listen to the apical pulse for 60 seconds, and that should be between 120 and 160. Then you're going to do a rectal temperature. That should be between 97.8 to 99. Then you're going to weigh the baby. They should be between 5 and 8 pounds. And you're going to do measurements. So you're going to measure from the top of the head to the bottom of the feet, around the circumference of the head, around the chest, and around the stomach. And then, let's see, for the skin, I forgot to note like the texture, if it's soft or rough. Then you should check if they have a Mongolian spot, and with the vernix. Then you're going to do the reflexes. So you're going to check if they're blinking, and the pupillary reflex, you're going to get a pen light and look at the eyes. If they don't open, sometimes you can lower the lights in the room to help them open their eyes. And you're going to check if their pupillary reflex is intact. And the moral startle reflex, you're going to like raise their arms and drop them, and they should fan out and then go back to their flexed position. Then you're going to look at their mouth. So usually you have gloves on when you're doing this, and you put it in their mouth, and you'll see if they suck on your finger. And you're also feeling the palate to see if there's like any holes, or if it doesn't feel like it's intact, the soft and the hard palate of the mouth. Then you're going to do the palmar grasp. So you're just going to put your hands in their hands and see if they grasp onto your hand like that. And you're also going to do it for the feet. Then while you're at the feet, you're going to do the Babinski reflex. So you kind of like draw a J up their foot from the bottom to the top, and their feet will go like this, will fan out like that. And then you're going to do like look at their neck. So they should be like moving around. If they have good neck movement, you'll note that. And just if they're like moving in general, they have good movement. Then you're going to look, then you're going to like stroke the side of them to see if they turn. So usually when you do that, they'll turn like toward the stimulus. And then whenever they're looking, if you stroke their cheek, they're going to turn towards that as well. Then you're going to be looking at their head. Sometimes they have a cone head because the bones in their head are, they like, mold while they're in the womb, and they're not formed all the way. So sometimes their head can come out like a cone, and which is normal. They usually mold back into that after delivery, which is called molding. And then you're going to feel the top of the heads for the fontanelles. The anterior will be on the top, posterior will be in the back. And you shouldn't feel like an indentation, you should just feel the landmarks. You're also going to feel the coronal suture, which is by the ears. And those are for the fontanelles. You're also going to be looking at their ears when you're on their head, and making sure that they have both their ears, that they, whenever you flex them like that they go back to the original position. And just checking if they can hear, if they respond to noises, and looking at their the top of their ears should line up with their eyes, and that would be normal. Then you're gonna look at the face, like if they have any marks. Maybe if they use a vacuum for the delivery, they'd have like marks from that, or any cuts or bruises. And then, yeah, all that. And then you're gonna look at the eyes. So you're gonna see if they're coordinated, if they're opening, if they're responding to the environment, and the color of their eyes, looking at their eyelids and their movement, the cornea, the sclera in their eyes, conjunctiva, so like underneath their eyes, and making sure their lashes, if they have lashes, and their lacrimal glands, so just pressing in on those lacrimal glands. And with their nose, you're going to make sure that they can breathe. So you would hold one nostril and see if they can breathe through the other one. And then you would do the same to the other side, just to make sure that they're able to breathe accurately. And I also forgot with the mouth, you're going to note any like discoloration, because that can have to do with poor circulation in their mouth if you see blue around their mouth. And so for the chest, you're going to look at the clavicles. So there shouldn't be any bones or anything. If you're like moving around and moving their arms, if you hear like a cracking noise, that is not good. And just make sure those are in place. And they should have like a bump on their chest, like right over here, and that's normal because that's just their sternum, and because their skin is so thin. So for the chest, you're going to be looking at the umbilicus also, if there's any bruises or edema or redness. You're going to look at the inguinal area. You're going to do the femoral pulses, and checking if they have any problems there. With their arms, you're just going to make sure they have good movement, and with their legs as well. So just doing range of motion, you're going to pull them up and then out to make sure their hip flexion's intact. And bowel movements, they usually have bowel movements, but it's not like super rough. And you're going to be looking at their bowel sounds as well, or listening to them. So you would just start in the right lower and go around that way. You're going to check if they have jaundice, which would be like a yellow coloration of their skin, and looking at their spine, making sure their spine is in midline, and the genitalia. With the males, you have to look to see if their testicles have dropped, so you'd feel like almond shapes, and looking at their butt, if they have Mongolian sign, which is like a bruising there. And with males, you have to teach the mom about like caring if they didn't get circumcised under the foreskin. And the females, they might have blood, like a fake period type thing, but that's normal. It shouldn't last for more than 1 to 2 days. And just looking if there's any swelling in the labia, and just to make sure everything is intact there, and just to see if they're crying. If it's a strong cry, a mild cry, if they're not crying at all, they should be crying because they're exercising their lungs, and that is good for them. So I think that's it, and that's my assessment.